So, you've recently had surgery for an artificial urinary sphincter, and you're probably asking yourself, okay, what happens now? Well, you've come to the right place. Think of this as your personal roadmap. We're going to walk through the whole recovery process together, step by step, so you can feel confident about the weeks ahead. We've broken this down into 4 key parts to make it super clear. First, we'll talk about what you can expect to feel right now. Then, we'll get into the big one, activity, your do's and don'ts. After that, we'll cover daily care and diet. And finally, we'll go over the really important signs that mean it's time to pick up the phone and call your doctor. All right, let's dive right into what's happening in your body as we speak. These first few days and weeks can feel a little strange or uncertain, but just knowing what's normal and what to expect is half the battle. It really puts you back in the driver's seat. Okay, this is super important to understand. Your device has not been activated yet. That means you are still going to be leaking urine, and I can't stress this enough. That is completely 100% expected. You'll also likely see some bruising and swelling, maybe some mild pain where the surgery was, and even a little burning when you urinate. All of this is just your body's normal way of starting the healing process. Next up, let's talk about activity. This is such a huge piece of the puzzle, but it's all about finding the right balance. You definitely need to get up and move, but at the same time, you've got to protect the work that was done. So let's break down exactly what that looks like. Think of this timeline as your long-term game plan. For the first 4 weeks, the rule is pretty simple. No heavy lifting, no intense workouts, and no sexual activity. Then, for 6 weeks, stay out of the water, so no baths, hot tubs, or swimming pools. And here's the big one. For a full 6 months, you have to avoid any activity where you're straddling something like riding a bike or a horse. That's absolutely crucial to protect the cuff while it fully heals around your urethra. So let's get a little more specific. What should you be doing? Walking. Daily walking is fantastic. Just listen to your body and slowly do a little more as you feel up to it. Now, what should you absolutely not be doing? Lifting anything over 20 pounds. No tough chores like shoveling snow or mowing the lawn. And try your best to avoid any long car trips for about 3 weeks. I love this phrase because it perfectly captures the mindset you need. While you're definitely taking it easy and avoiding anything strenuous, it's just as important that you don't just sit on the couch all day. Getting up for light, regular walks is so good for your circulation and your overall recovery. It's all about finding that sweet spot between resting and gentle movement. Okay, here's a super simple but very important little task for you. To make sure the pump stays in the right spot for when it gets activated down the road, you just need to gently pull it down. So find the pump in your scrotum, give it a gentle downward tug, and do that 3 times every single day. Easy peasy. Now let's switch gears to daily care. You see, healing isn't just about what you do on the outside, it's also about supporting your body from the inside. Let's think of this section as your personal toolkit for a smooth recovery. First up, let's talk about fuel for your body. Water, water, water. Aim for about 6 to 8 glasses a day. You can get back to your normal diet whenever you feel ready, but try to load up on fiber. Think fruits, vegetables, and salads. This is going to be a huge help for our very next point. And here's why that fiber is your new best friend. You absolutely want to avoid straining when you have a bowel movement. All that pressure is exactly what you don't want near the surgical area. So to make things easier, you can use a stool softener, keep drinking those fluids, and maybe add a little prune or apple juice into your day. The goal is to keep things moving along smoothly. All right, what about keeping your incision clean? Here's the plan. You need to wait 48 hours after your surgery before taking your first shower. After that, you can shower every day. Just let some soapy water run over the incision, don't scrub it, then rinse it and gently pat it dry with a clean towel. And remember what we said earlier, showers only, no baths or swimming for 6 weeks. We've now arrived at our final and I'd say most important section. It's your job to follow all these guidelines, but it's also your job to be an expert on your own body. Knowing exactly when to pick up the phone and get some professional advice is a huge part of a safe recovery. So let's be crystal clear about the warning signs you need to be looking for. Think of this as your personal safety checklist. If you notice any of the things we're about to talk about, don't just wait and wonder. Make the call. The first and maybe easiest one to spot is your temperature. If you check it and you have a fever over 101 degrees Fahrenheit or about 38.3 Celsius, that's your cue. Call your doctor's office right away, because that could be a sign of an infection. Keep a close eye on your incision. If you see it getting really red or swollen, if there's any pus, or if the skin around it feels hot to the touch, that's a call. You should also call if you're in severe pain that Tylenol or ibuprofen just isn't touching, or if you feel sick to your stomach and can't keep liquids down. And finally, and these two are really important, watch for any urinary changes. If your bladder constantly feels full, or if you suddenly stop leaking urine completely, you need to call your doctor right away. So, when you boil it all down, what's the big takeaway here? It's that your recovery is a partnership between you and your healthcare team. By following these steps, you're doing your part to get the best possible result. And please, never forget, no question is ever too small or silly. If you're ever unsure about anything at all, just call. Your health is and always will be the #1 priority.